right, Facebook, we're good to go. Instagram, we're good to go. Good morning, happy Friday. This is your PT on Ice Fitness Athlete Friday. I am Megan Peach. Excuse me. I am one of the faculty for rehabilitation of the injured runner online, and starting in January, I will also be faculty for rehabilitation of the injured runner live. So, if you haven't yet had a chance to take rehab of the injured runner, we have some great things in store for 2022. So, make sure you get over to the website to check that out. Super excited to get that on the books for 2022. So today I'm going to be talking about bone stress injury evaluation. And if you didn't get a chance to listen to Rachel Selena's daily show last Friday, try to get some time carved out to watch that. It was on treating the non-injured runner, which is kind of a unique topic and a lot harder than it might seem. And I definitely struggle with treating a non-injured runner. So I'm going to go to the other end of the spectrum today and talk about evaluating runners with bone stress injuries. And I say that this is the other end of the spectrum because most of the time, treating runners is something that we can do while keeping them running. But bone stress injuries are a little bit of a different story because if we pick up indications that we might think are consistent with a bone stress injury, then that's a situation where we have to ask that runner to stop running. So, kind of a bummer, but it's definitely the other end of the spectrum. So let's kind of dive into evaluating and tests that we might use in clinic for evaluating bone stress injuries. So historically, what tests are used for treating bone stress injuries? Gold standard are MRI and bone scans. So an MRI, obviously really expensive, but it does give us the best image in terms of not only can we see a stress fracture line if that's present, but we can also see edema within the bone, and potentially could use that as comparison with an MRI down the road, should that person need additional imaging. Bone scans are much cheaper than MRI, but they don't necessarily show the edema within the bone. So they can show a stress fracture, but they're not going to show the edema within the bone, which can be helpful in grading the extent of that stress fracture or that bone stress injury. But often we're seeing these patients as direct access, and often they don't have imaging to go by. So we're having to use clinical tests that I'm going to talk about today in terms of the statistics that go along with these clinical tests and why you might choose to use one and not the other. So historically, ultrasound and tuning forks have been used to diagnose bone stress injuries. The ultrasound, however, it's kind of clunky, takes a long time to do. There's some setup involved, obviously. And it's a pain provocation test. So we're looking to provoke some of their symptoms when we're using the ultrasound to diagnose a bone stress injury, but it has really, really low sensitivity, low 60s. And when we have low sensitivity, that means that there is a high likelihood that we're going to get a false negative. That means that there's a high likelihood that we're going to miss diagnosing whatever condition we're looking at. And in the case of a bone stress injury, we don't want to do that. That's the worst case scenario, is to miss a positive test. And so we do not want a false negative on any one of these tests. And so it's junk. Ultrasound is junk. We can't use it to diagnose bone stress injuries. We're going to miss too many of these conditions. And I don't want to send a runner away telling them that they can continue running when actually they need to be resting from running and other impact activities as well. So that's out. So Our next one that's often in the literature, but not super common in clinic. I use it very seldomly. Occasionally, if I'm kind of on the fence, then I'll pull it out. It's super quick. Tuning forks come in different frequencies. So often in the clinic, you'll find a 128 hertz tuning fork, which is what we have. And there's also 256. The 256 are a little bit better in terms of diagnosing a bone stress injury, but not by much. There's a couple of recent studies that came out this year that looked at the statistics for different tests for bone stress injury evaluation, and they found super, super low sensitivity for the tuning fork, like 0.16. So it's not even a usable test. Clinically, the statistics are too low for ultrasound and tuning fork to actually be diagnostically used for bone stress injuries. So I want to talk next about just a couple of studies that came out this year in regards to diagnosing bone stress injuries. One of them was in the Journal of Science and Medicine and Sport, and that one looked at military recruits. And what they did was take these recruits who had signs or symptoms consistent with a medial tibial stress, bone stress injury, stress fracture. And they did a palpation, they did a fulcrum test, and they did a single leg hop test. And they were able to do that testing prior to imaging, which was an MRI. And then in the other study in sports health, also of this year, they took adolescent athletes and they did similar tests. They added in a tapping test, which is basically just tapping on that site that's painful. They added in a tuning fork, and then they added in a range of motion, like a standing lunge test that's very similar to a knee to wall dorsiflexion test. They called it a weight bearing lunge. And then they also did the single leg hop test to 10 repetitions of maximum effort. And then they also compared these test results to MRI imaging. So I'll talk about the different tests individually. So for palpation, something we commonly use for every single patient we see, these studies found that palpation was actually a fairly good test for diagnosing bone stress injuries. But the caveat is that the tenderness to palpation has to be either less than 1/3 of the length of the tibia or less than 10 centimeters. So it's a very, very narrow area that we're expecting to be tender when this person is positive for a bone stress injury. If it's a wider area, so greater than 1/3 of the tibia or greater than 10 centimeters, really we think of it like as if it's greater than a couple of finger breadths, then it's probably not a bone stress injury. It's probably something more like medial tibial stress syndrome or a muscle strain or a metatarsalgia, something else. But with bone stress injury, we really are specifically looking for a pinpoint tenderness. Palpation actually had very, very good statistics in the negative predictive values. So when a test is negative, what is the likelihood that they actually do not have that condition? And it was near 100%. So if I'm palpating somebody and they have no tenderness on the bone that I'm suspecting, then I can be fairly certain that it's not a bone stress injury. Next is the fulcrum test. So this is also a pain provocation test. And with the fulcrum test, you are actually trying to fulcrum that bone in question over a pivot point. So typically we'll take our arm, fulcrum the bone over the arm, and looking for signs and symptoms of pain. Obviously, this test is better assessed for or better used for long bones. It doesn't work with something like the navicular. If you're expecting a stress fracture in the navicular, it only works with long bones. With the fulcrum test, the statistics were very, very low, 0.12 for sensitivity. So really not a very usable test in terms of diagnosing bone stress injury. We also have the hop test. This is one that I've picked up more recently. I'm using it more recently because it does have better statistics. It's the most sensitive test. So in this test, we're the least likely to have a false negative, which again, worst case scenario, I don't want to send a runner out of the clinic continuing to run when they actually have a bone stress injury. It's a pain provocation test. Typically, it's a single leg hop to a maximum jump height. 10 repetitions, but that really varies in terms of the test protocol on what article you're referencing. Sometimes they'll go longer, sometimes they'll go for 20 or 30 seconds, sometimes it's a repetition. It really does vary, but it has good statistics, so sensitivity is a bit better. Also, the positive predictive value on this is about 84%. So when we get a positive test and they have pain with a single leg hop, then we can be fairly certain with about 15% uncertainty that this person actually has a bone stress injury. The last test is a needle wall test, and there was zero correlation with bone stress injury for either study with any of the range of motion tests. So, a good assessment tool in terms of range of motion, not so good for bone stress injuries. So basically what these two more recent studies, as well as older studies, what they tell us is that we don't have a single test that is good to use for evaluating for bone stress injuries in terms of the statistics that go along with those tests. We can't use a single test to diagnose. We can use a cluster of tests. One of the studies found that there was statistically significant greater incidence of the tibial bone stress injury with three tests: palpation, the fulcrum test, and the hop test combined, compared with only palpation, which is what we would expect. We would expect better statistics with a cluster of tests picking up a bone stress injury and a true bone stress injury than we would with a single test. And so we can use cluster of tests. Personally, I have a hard time remembering, okay, this cluster goes with this. These are the tests of this cluster. Seems like we have different clusters made from different people for every single region of the body. And so I have a difficult time remembering exactly which cluster is which. But I think if you think in terms of how we generally think as PTs, we're very, very good at clustering a lot of information together. So if you know the general test, you know palpation, you know your hop test, you know your fulcrum test, you know there are backup tests like tuning fork and ultrasound. They may not get used as much, but we still have them. And so I think if you understand how to use those tests and are able to cluster them yourself, then we can come up with fairly good diagnostic evaluation tools to use with bone stress injuries. Another combination of tests to mention was that the fulcrum test, tuning fork vibration, and a single leg vertical hop, if all of these are negative, then there's a very, very high likelihood that that individual does not, in fact, have a bone stress injury. So you can use clusters in terms of positive findings or negative findings. It just kind of depends on which test you're using. So what we haven't talked about yet, and what I'll talk about just really briefly, is that we can get a whole cluster of positive tests, or we can get a whole cluster of negative tests. And as much sense as that might make to have positive or negative findings, it still has to fit with the history. That subjective exam is super, super important, especially with bone stress injuries. And I consider it just one more piece of information. It's one more part of my cluster of findings. And why it's so important is that there are very, very few studies out there that suggest that there are spontaneous bone stress injuries. Very few. It does happen, but it's not the norm. And so when we're suspecting a bone stress injury, we're also suspecting certain things to be present within the history. And bone there's potentially high impact athletes, basketball, volleyball, jumpers. Way less incidence in any other sport out there. And so we're looking for that in the history. And the other things we're looking for are things consistent with the development of a bone stress injury or stress fracture. So high volume in terms of weekly volume, daily volume, high frequency, minimal rest. We're questioning for diet and nutrition, energy availability, maybe a familial disease of bone injury or bone disease, sorry, familial history of bone disease. And so if our patient is coming up with no's on all of these, then we're starting to think that maybe this isn't a bone stress injury. So what I'm saying is that their history has to match, just like we're looking for positive or negative tests with the special tests we would use objectively. We're also looking for very specific findings within their subjective exam. Okay, so to summarize this, what I'm specifically using in clinic, what seemed to work well for me, is taking a thorough subjective exam. I am looking for training variables, history, energy availability, and nutrition to fit in with what I think should fit with a stress fracture or a bone stress injury. Objectively, I tend to gravitate toward palpation as well as the hop test. I'm pretty confident in my knowledge of anatomy. I know I can rely on that knowledge. And I know that if that person is negative for provoking tenderness with palpation, then I can with almost 100% certainty, rule out a stress fracture or a bone stress injury. So, I like to use the palpation, and then I like to use the hop test as well. It seems to be, just anecdotally and through the research, one of the more provocative tests, more so than the other objective tests that we used. And it is the most sensitive test. So generally I'm going towards hop test, palpation, as well as using history. If I haven't come up and I'm still suspecting at that point, then I'm trying my other tests to see if they come up with anything, or starting to ask more questions. Okay, that's all I have for you on bone stress injury evaluation. I hope that was helpful. I hope you enjoy your Friday and your weekend and have a very happy holiday. We'll see you soon.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.